I'm here with Piers today. I am so excited to share this story with you guys. Piers came to us with long COVID and he tried so many things before he came here. I think there are so many people that are suffering and struggling after long COVID, and they are frantically looking for solutions. And let's just be honest, the medical community seems to not have the solutions that they need. So I'm so glad he found us. And Piers, I just want you to share, first just talk about your symptoms. What were you struggling with? What was your daily life like for the last few years?
Yeah, sure. So I got COVID in August 2020. I was hospitalized for 2 weeks, but back then the doctors kind of knew what medication to give me, so I kind of recovered quite quickly from that. And then in January 2021, my long COVID started. And my main symptoms have always been nausea, horrific nausea. And the symptoms just kind of got worse and worse, and I kind of got every single symptom from muscle tremors to waking up with a kind of crashing depression every morning. I've never had nausea before, I've never had depression, muscle spasms. I got every symptom apart from brain fog. And I went to, my mum sent me to a clinic in Austria, a wellness clinic. They took all my medication away. My acid reflux was through the roof, and that's when things started happening. That's when the crashes started coming. I'd sleep for kind of 4 to 5 days at a time, but the really big thing for me was the nausea. I saw maybe 200 doctors. I've kind of gone through my whole, what happened.
Wow, 200 doctors.
200 doctors across 7 countries, 3 continents. I was told so many different things. I was diagnosed with so many different things. Eventually, long story short, I was diagnosed with gastroparesis and autonomic dysfunction. So on the gastroparesis side, it's the food going down too slowly. My main issue with that again was nausea. I found that no drugs work, no medication worked for nausea, but I did find that IV cyclizine helped me. So I did that twice a day, but the doctors really were against me doing that because they said you can die from an infection, but you can't die from nausea. And honestly, that's the most unhelpful thing I'd heard. It's probably true, but it doesn't help someone when you've got crazy nausea.
Yeah. Were you getting sick as well?
I was never throwing up. I kind of wish I had, because
Right.
maybe it would have relieved the symptoms.
Right.
Yeah, so then 200 doctors, all the nausea, autonomic dysfunction, which meant that I passed out quite a lot, and it was always against the corner of a wall, which is why I've got these scars on my forehead. And I never knew when I was going to pass out, which is a scary thing, because if you're on your own and you hit a wall, it's just frightening when you're on the ground and you realize what's happening. Yeah. And then so once I got diagnosed with gastroparesis, I got the diagnosis of autonomic dysfunction, and this is having been across all these countries. I was told that I could get a gastric pacemaker, which they'd said is the most powerful anti-nausea device on the market. So I had one of those which sits my stomach. That was put in about 2 years ago. That has never worked to date. And when I kind of went through all the medical stuff, I started looking at alternative therapy. And that is when I found a long COVID breathing doctor, a lovely lady in Arizona. And I found a somatic healer in Berlin. And eventually they put me in touch with you guys, Spiro Clinic. And that's how I came to being here in September of this year.
I love this story so much. And one of the things that I love is feedback we get a lot is, wow, this clinic in Arkansas, there's no way it can be that good. But there are so many patients like you who have traveled the world and truly been to the best of the best doctors and hospitals. And it's not that they're not brilliant and very gifted at what they're doing. It's just that I think they don't have this in-depth approach to nervous system rehabilitation, and that's what you needed.
Exactly, and so I didn't know anything about the nervous system. I didn't really know about parasympathetic, sympathetic state. I didn't really know much about the vagus nerve. I have every single gadget at home that does the vagus nerve stimulation or says it does. But yeah, it's been a complete. So I've been to a clinic in South Africa for 10 weeks, and when you go there and you're promising your family this is it, this is going to get me better, you kind of get a little bit disappointed when you know 2-3 weeks in you're probably not in the right place. When I got here, meeting people who have long COVID symptoms exactly like you're, probably worse, is the biggest game changer for me. I knew the first week I got here that I was in the right place, and I texted my family and they're like, but you've told us that before. I'm like, I promise you I'm in the right place, because you talk to people who are often, I mean, I heard some harrowing stories, you know, people that couldn't eat, can't see sunlight. I didn't have any of that. Feeding tubes, I nearly had one of those, but not. And just meeting other people who are in your situation or possibly worse is so powerful, to speak to them. And then to watch them graduate in the first 3-4 weeks, and they've been here 12 weeks and they'd come in wheelchairs. So that was huge for me mentally, physically. And I just said to my family, I know I'm in the right place. I think I spoke to you and we had a call, and I told you I'm in the right place. And my progress went up. In the beginning, it kind of came down. The progress doesn't go like that.
It's like this.
It's 100% like that. And the last 3-4 weeks, I've just gone straight up.
Wow. So where are you at today with your symptoms?
So I'm on zeros for everything. Zeros for nausea, zeros for autonomic dysfunction. I don't even think I need to take blood pressure pills. I certainly don't take any medication for nausea. Post-exertion malaise, I don't really get. We do really tough NMR training here with our lovely NMR therapist. So yeah, I'm graduating today and I'm the happiest boy alive, and I get to go home and see my family and be with my 4-year-old son. I've been sick for 4 years, so he finally gets his dad back. Yeah. Wow,
that is so amazing.
So come to Spiro, everyone, if you've got long COVID. I really, really mean that. The sooner you get here, the sooner you'll get better. And that's right for me.
I'm so happy for you. Thank you so much for sharing your story.
Thank you.